Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. It's great to be with you today. Thanks for joining. Compared with other types of cancer, testicular cancer is relatively rare. But testicular cancer is the most common type of cancer in males between the ages of 15 and 35, particularly in the United States. Testicular cancer is highly treatable, even when the cancer has spread beyond the testicle. Depending on the type and stage, there are several treatments or combinations of treatments available, and we're going to learn about those today. Here to discuss this with us is Dr. Matthew Ziegelmann, urologist at the Mayo Clinic. Thanks for being here today, Dr. Ziegelmann.
Hey, good morning, Dr. Gazelka. It's absolute pleasure, and thanks for the invitation.
Well, November is Men's Health Month, and so we want to be sure to get some men's health topics in. So thanks for joining us to share a little bit. Would you tell us a little bit about how would someone know they might have testicular cancer? What are the symptoms?
Sometimes cancers, when they present with pretty obvious symptoms, but with testicular cancer, a lot of times it's just feeling a lump in the testicle. So most men who present with testicular cancer don't have pain, don't have discharge or systemic symptoms like fever or chills, but they have a change in how the testicle feels, or the shape of the testicle, or the look of the scrotum. And so oftentimes it's a young man or an older man who comes in and says, "Hey, doc, I feel something different when I'm feeling down in the area of the testicles."
So this is one of those types of cancer that seems to have be shrouded in a lot of mystery and have some myths that surround it. And so we hear about what might cause testicular cancer, and I'm hoping you can clarify for us. Some of the myths that I have read are, does riding your bike cause testicular cancer? Does injury to your testicle cause testicular cancer? Does having a vasectomy increase your risk?
I've heard all those myths. I've been asked all those questions in the context of caring for young men. The short answer is that, to our knowledge, none of those things, riding a bike, having a vasectomy, prior injury to the testicle, none of these things have been shown to increase your risk of testicular cancer. With respect to the bike riding, that may pertain to some of the prominent figures that have been diagnosed with testicular cancer in the past. I think with respect to testicular injury, if someone injures their groin, they're more likely to be kind of paying attention to the area, so they may notice something that's different, whereas they wouldn't have been paying attention earlier. And as far as a vasectomy, there are at least 500,000 vasectomies performed in the United States each year, and there's far, far less diagnosis of testicular cancer, and there's no good evidence that that's associated with testicular cancer. I think the biggest risk factor here is, one, just being a man, so having testicles. We know that men who have a family history of testicular cancer, so maybe their dad or brothers have been diagnosed with that would be an increased risk, as well as having what's called an undescended testicle. So some men are born with a testicle that's not all the way down into the scrotum. It kind of sits up higher, and sometimes that requires surgery. And we know that that's also a risk factor for testicular cancer.
Why is it then that this is a cancer that strikes young men rather than the more elderly or older people?
In reality, testicular cancer can occur in men of all ages, really more prominent in young men because other cancers are less common, right? So the most common cancers in older men are things like prostate cancer, colon cancer, lung cancer, whereas in young men, those cancers are far less common. And so for one thing, the testicular cancer is just more prominent relative to these other diagnoses. Conditions that may predispose to testicular cancer, like I said, the high riding testicle that you're born with, or the undescended testicle, those occur early in life. These men may be more likely to develop these changes to the testicle and to the cells within the testicle that ultimately result in formation of cancer.
You mentioned a couple of times now about undescended testicles, and that sometimes individual may require surgery to correct that issue. Are there other ways that men can prevent testicular cancer from developing?
I think, to me, the most important thing is, just as a young man, getting to know your anatomy. So oftentimes we'll talk about testicular self-exams, and to an extent. That's just every so often feeling the testicles, feeling the structures within the scrotum, and sort of understanding what your baseline is. So if something changes, you can then recognize it. I think also in general, the better your overall health, the less likely you are to develop cancer. So whether that's, modifying your stress, getting good sleep, eating a heart healthy diet, exercise, all of those things can really be beneficial for your overall well-being. And that's certainly true for all forms of cancer, including testicular cancer.
So a young man might find a lump, might be the way that this would be discovered in his testicle. And after getting up the courage to ask someone about it, what are the steps in a diagnosis?
So I think anytime a young man notices a new lump or a bump in the testicle, it can be very stress provoking for that young man. But just important to know that there are a lot of other reasons that you can have a lump or a bump in the testicle. And so the first step is really to just get in to visit with a healthcare professional to have an examination. Oftentimes, if we feel something abnormal, we'll do what's called a testicular ultrasound, and that's a non-invasive test. There's no pain associated with that. It's just a way for us to actually image and take pictures of the testicle to look and see, is that lump or bump something that's concerning for testicular cancer? We'll usually also get blood tests looking for what are called tumor markers, and these are um, basically compounds that we can measure in the blood that are sometimes associated with testicular cancer. Sometimes the tumors can secrete specific chemicals. And ultimately, if we're highly suspicious for a testicular cancer, and this is different than some other types of cancer, the way we diagnose this is actually to get a tissue diagnosis by removing the testicle via a surgery. It's an outpatient surgery. The recovery is pretty quick, and most guys do, or all guys do really well with that surgery. But really, that is the way we make that final diagnosis.
What are the treatment options that are available, and how do you know which treatment to give a young man?
Testicular cancer in general, the treatment algorithm always starts again with that surgical removal of the testicle. For the vast majority of men, that's the treatment. Once you remove those cancer cells, remove the testicle, that oftentimes is all that man will ever need for treatment of their testicular cancer. We do need to follow people closely because there is a chance that cells can spread outside the body. I call them rogue cells. For most men, that's the treatment. Now, if there's been testicular cancer that's spread outside, oftentimes that will first go to lymph nodes that sit in the back of the abdomen, can spread to other places in the body. We diagnose that usually by CT scans and other types of imaging, and that may prompt us to consider other forms of treatment like chemotherapy or even radiation or surgery or some combination thereof. But even in that setting, I think really important to emphasize, and one thing I emphasize when I'm first visiting with a patient and saying I'm suspicious for testicular cancer is that this is an extremely treatable form of cancer. The survival rates, even in the setting of men who've had testicle cancer spread outside of the testicle, are extremely high, far greater than 90%. And so I think really when people leave the office, I want them to have sort of that sense that we're going to tackle this together, and this is a bump in the road as far as that's concerned. The way we treat cancer, whether it's urologic cancers or elsewhere, there's been so many leaps and bounds over the last several decades, but specifically in testicular cancer, this is one of the most treatable forms of cancer.
Well, on the scale of things that might be anxiety provoking for a young man, I would think hearing that they must have a testicle removed would be really highly anxiety provoking. Does that render any difficulties with sexual function?
I think it's important to kind of differentiate the two aspects of what testicles do for us in the body. And they do really two things primarily. They make testosterone, which is sort of classically considered the male sex hormone, and they also produce sperm. And the nice thing is that for most men, we have a testicle on the other side that can, as I'll describe it, pick up the slack. So as far as the ability of that testicle to produce enough testosterone for that to have normal range and to have normal sexual function, absolutely. The vast majority of men will maintain their sexual function. Recovering from surgery and things like that can make people feel a little bit out of their element, but ultimately long-term sexual function should be maintained for most men. Fertility as well. For the majority of men, they'll maintain fertility because the sperm production will be picked up by the other side. Now, once we start getting into those other types of treatments for more advanced testicular cancer with chemotherapy, radiation, other types of surgery, that's a little bit more nuanced. But for the majority of men, again, where we're curing their cancer by removing the testicle, we're maintaining fertility and sexual function. And another important thing as we're talking about talking to these young men before surgery, will always, and I think everyone should be asking about this if this isn't brought up in the context of a visit, we'll always offer fertility preservation, where the young man will leave us some semen samples so that we can freeze that sperm, so that if fertility is affected down the road, we have the ability for that man and his partner to conceive.
Does a single testicle produce half of the sperm that two testicles did? Or when you say picking up the slack, do you have the same production later?
From the data that's available, it seems like if you look sort of at the numbers of sperm that are produced in a sample, that may go down slightly. It's not 50% though. So the other testicle has the ability to produce more than 50% of the normal sperm count. And when you look at, does that slight decrease in sperm count affect your ability to conceive, it doesn't look like it has a meaningful impact. So the ability to conceive spontaneously with your partner seems to be maintained, which is great news for our patients.
Yeah, very reassuring considering the age range that we're talking about, people who are looking forward to starting families at some point. So that's
Exactly.
great. You mentioned earlier the advances that have been made in the last years and decades in this field. And I'm wondering, what is the research that's currently ongoing regarding testicular cancer? And what do you think is coming down the pike?
Yeah, there's always been a lot of cutting edge research looking at how we can better stage patients. So meaning how, when you come back for your follow-up after the testicles removed, what kind of scans are we doing? We're trying to minimize radiation exposure and things of that nature. But I really think the hottest topic these days pertains to, I think I briefly mentioned this, there's these chemicals that we measure in the blood called tumor markers that are secreted by certain types of tumors. And there's a lot of nuance there. And there's a lot of imperfection in some of these markers. But lately, there's been an interest in what's called microRNA, which is a really fine-tuned cellular marker that we can measure in the blood that seems to be a great resource for us to identify those patients who may have recurrence of their testicular cancer, but we're not seeing it on their images. And so this may actually be an opportunity for us to further enhance our follow-up for our young men in a safer and more efficacious manner. And ultimately that may lend towards differences in how we offer chemotherapy and radiation therapy, surgery. We just finished a trial up here at Mayo Clinic for patients who had more advanced testicular cancer, where historically they'd be offered radiation or chemo. And instead, we're offered surgery, and we were one of the leading centers here, and the outcomes look very promising. The final results haven't been published yet, but the ability to avoid chemotherapy and radiation and undergo a surgical procedure where young men tend to recover quite well is a really nice option that could change the face of how we treat advanced testicular cancer. So lots of cutting edge research being done throughout the United States, throughout the world, and even here at Mayo Clinic. It's really exciting.
Thanks for being with us to share about this today, Matt. Our thanks to Mayo Clinic urologist Dr. Matthew Ziegelmann for being here today to talk to us about diagnosis and treatment for testicular cancer. Remember, men, it is Men's Health Month in November. We call it Movember. So we encourage you to see your provider with your questions or to seek out your preventative health maintenance exams this month.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well.